This is a blood pressure cuff machine. It's a noisy pump that pumps air into this cuff, and this cuff is supposed to constrict your arm, then as the air gets released, it determines what your blood pressure is. There are criteria for labeling somebody with high blood pressure, and unfortunately some people will come into the office and get a checkup starting with that. Usually it's all downhill from there because that thing makes noise, you can hear the Velcro snap, it constricts your arm, kind of, I guess, stressful for some people. There's something called white coat hypertension that is a label we give to anybody that gets stressed out when they come to the doctor's office. We used to not do anything about that because we understood some people just don't like the doctor office experience. I didn't like the doctor office experience, but it's still important to have checkups every once in a while. And this is the reason I'm doing this video, is I see a lot of people in the immediate care center that don't see doctors because they don't like doctors, and that's okay to say. But I don't think it's personal. I think it's they don't like the experience. This is a cold environment. You get put into this paper gown with you being naked to a stranger. You gotta get somebody to stick this thing in your throat. You gotta get somebody to check your genitals, and then you hear this. This is the snap that usually occurs right before you get either a pap smear or a rectal exam. And those things are usually kind of intrusive, and that could lead to anxiety or anxiousness about what's going to happen with this physical exam, or how big are the doctor's hands, or is this doctor gentle? Regardless, I can see how some people just don't like going to the doctor's office for a checkup. But when I hear that I don't go to the doctor's office because I'm healthy, and yet I don't get a checkup, that sometimes makes me worried because everybody has a different opinion on what is health. If health is meaning that you don't get colds or coughs, that's one thing. Sometimes smokers are a little bit resistant to bacteria because the smoke destroys the bacteria. And by the way, if the smoke destroys the bacteria, guess what it's going to do to your lungs? So sometimes that's not a good gauge for whether you're healthy or not. I think, like everybody's going with this paleo diet. The paleo diet's pretty decent. It goes back to the ancient way of eating, kind of like hunter-gatherer states. I think if you act like a hunter-gatherer, if you can get out off your bed, out of nowhere, and do a mile, whether it's walking or running, without any hesitation, you get through that without being short of breath or winded or having knee pain. If you eat mostly plant-based whole food diet, if you sleep at least 6 to 8 hours a day, if you don't have any other problems or exposures to alcohol or tobacco, and your body weight is good, I think that's pretty decent. For the most part, you're probably living a healthy life. Oh, the other thing also is that if your family history is negative, mom and dad lived till 80 years of age with no problems, your siblings are all healthy, no problems, then you're probably right, you're probably very healthy. But if you don't have that, and you have a parent that has heart disease, or a parent with high blood pressure or diabetes or cholesterol, if you are overweight, and look at my video for BMIs, acceptable BMIs, if you don't eat a mostly whole food plant-based diet, and if you can't get out and do a mile out of nowhere with no problems, or you don't exercise 5 days a week, or you're very tight, inflexible, then the likelihood is that you are a setup for something to happen. Whether you will notice it or not, probably not, because usually disease is very slow in onset. A good immune system will fight off and just give a little bit at a time away to the disease process. So after doing 50 hours a week of work and not having time to exercise, you'll be able to get through that 50 hours a week. You'll be able to work as usual, but slowly every year you'll get sicker and sicker. You'll have more symptoms that kind of get added to your body. You'll have more weight, you'll have poorer sleep, you'll have less temper tolerance. Your thinking will be off. All these things will slowly or insidiously add up. And when they add up like that, very slowly, you'll not notice them. And that's why it's good to have a doctor take a look at you. The research now today, medicine is very evidence-based. And it takes the decision-making process out of the doctor and puts it into an algorithm. So that's when it's good for the government, it's good for the massive population, because it sometimes saves money. But medicine, this is the caution here, medicine is an art. It is not one algorithm or one cookbook recipe that can be applied to everybody. Those are all guides, but the time spent between the patient and the doctor in a room is valuable to kind of tweeze out from the history, taking the questions and answers, the past medical history, the social about what you do all day. It's important for the doctor to tease out where are the risk factors in this one guy. Where can I make advice, or gal, where can I make advice on changing a couple things, working on weight, listening to what has failed in the past, listening to why the person doesn't want to get into the doctor's office, and kind of saying, okay, we have to change this, this, and this, come back and see me in a year. Or there's a big family history of something coming up, so let's check and watch for that one thing. It might just be negative that year, but every year it has to be kind of reformulated. So the plans that get put together or designed by your doctor on either getting tests done, getting problems answered, or just saying, okay, we're cool, see you in a year, are very individualized. And with that kind of practice, I think most of us will stay healthy. The problem, I think, is when people go to the doctor's office just for colds and cough and they don't go for guidance about making other lifestyle changes. That's the downfall of medicine and insurance-based healthcare. But that's where the ancient medicine of either Ayurveda or acupuncture, even American Indian medicine, there's always old sayings that you wonder, if you eat and then go swimming, or if you don't dry off your hair after being out in the rain for a long time, does that really make a difference? Does chicken soup help with getting better from a cold? I think there's value in the time period that medicine, or ancient medicine, has established in working its wonders in just eating properly, eating home-cooked meals instead of fast food. I think there's wisdom in that, but the idea is to apply all the old stuff, kind of take bits and pieces of the new stuff, put it together in a formula that can work for an individual patient, and then seeing how that formula might apply and tweaking it here and there. So as far as not seeing a doctor, I disagree. I think that I can always find, especially in my average American that comes in, I can always find a problem that might interfere with you getting to 80 to 90 years of age without any medicines or surgery. And sometimes it might be a small one, but it's still an idea to go for a goal of changing that around, or at least planning with your doctor how to change that around. I don't agree with not seeing a doctor for a physical annually. I think whether you do a pap smear or whether you do a prostate exam, it's part of the whole process of kind of figuring out things. So my challenge to people who say, do I need a physical? Well, if you can say that your life involves everything I mentioned earlier, and I'll list them over here, then fine, you're probably okay. If you don't have insurance, then wait, but maximize on what a human should be living, or how a human should be living. If you're the ultimate hunter-gatherer and you're healthy and you're in a good job and you don't work more than 40 hours a week and you have a great family you can commune with, I think that's fine. But be wise and kind of research what you should be looking for with your lifestyle change, or your lifestyle as it is, or what the past history in your family indicates, and take that to a doctor that you trust, and hopefully a plan can be given. So take advantage of what's around you. Be wise and listen to your body. That's the most important thing. Listen to your body. If your body is saying, I've got to lose weight here, or I can't go up a flight of steps anymore, then that's a sign that you probably should be making a change of some sort. I think we often kind of forget and push away the signs and symptoms, and we kind of say, yeah, I'm okay. I don't need a doctor, I don't get sick. And that's not the only thing that we look for as doctors.
Maybe you're too old for that. How about that?